Hey y'all, and welcome back to my channel. On this page, I talk about technology and money, and then sometimes I also cover trending news. If you're new here, welcome to the channel, and if you're a returning subscriber, welcome back. Please consider liking and sharing the video. Liking and sharing the video does two things. It's you telling the algorithm that you find this information interesting, engaging, educational, and it helps more people find it. So you're actually adding value. And then number two, it encourages me to continue creating content that you all find helpful. I have two articles, two or three things I wanted to share and talk about the growth of retail healthcare, which I talked about a little bit in the video I did either earlier this week or last week around the continued evolution of innovation in tech and healthcare. But I came across something interesting that is happening in retail healthcare. I know at the end of last year, my 2022 wrap up, I talked about Dollar General and what they are doing in retail healthcare. But it's interesting what some of the other larger pharmaceutical giants are doing to leverage technology and being innovative. So I want to talk about that. Then I'm going to talk a little bit about top health informatics trends in 2022 as told by professional physicians and nurses in the IT C-suite. Okay, so let me start by sharing my screen. And I hope everyone's having a good day so far. Bear with me. Okay, here we go. All right. Y'all seeing that okay? Let's see. Let's try it again. I think it was doing something real funky there. Okay. Let's see. That look okay, guys? Just bear with me. Let me do a quick check. Oh. It's doing that. Hang on. Oh, I see what. Okay, we're going to try that one more time. There we are. Okay. We got it, y'all. That should be, thank y'all for your patience. Yes, perfect. Okay. So, let me do that. Okay. So first, I want to talk about what Walgreens CEO Roz Brewer is doing in healthcare. So you all know Walgreens retail pharmacy. Roz Brewer, I've been following her career trajectory for a while, mainly because she's one of the few Black women who have made it to CEO C-suite positions in leadership at like a Fortune 500 company. And this article talks a little bit about it as well. And I have some key lessons and takeaways. So this article is from Business Insider. And as always, I'll be sure to leave a link to this article in the description box so you all can come and check it out. So you all can go and read it for yourselves as well. So the article says Walgreens CEO Roz Brewer wants to make getting healthcare as easy as going to your neighborhood pharmacy. I have some lessons on why this is so important and why we all should be paying attention to this and why it is so important. There are some reasons, okay? So let's get into the article. Let's make this go away. Okay. Well, all right. I should turn that. Okay. So it says that Rosalind Brewer knows what it's like to be the first or the only. So she runs Walgreens Boost Alliance, and she's only the second Black female to be named the permanent CEO of a Fortune 500 company after Ursula Burns became the head of Xerox in 2009. And this is important. Now, Ursula Burns is another Black woman in tech that her background is actually engineer. She's either a mechanical engineer or an electrical engineer by trade. But when Ursula Burns became the CEO of Xerox, her story and what she did becoming CEO was very notable for a couple of reasons. Not only was she the first Black woman to be named CEO of a Fortune 500 company, it was also the first time in like history for a Fortune 500 company for the CEO role to be handed over from woman to woman. There was a woman in the CEO role before Ursula Burns. She was I forget what her name was, but she was not a Black woman. So Ursula Burns has since left Xerox. She's moved on. But so anytime I see women, particularly minority women, Black women who work in tech or STEM careers, and they're in a C-suite position, I always pay attention and always very much interested in their story. So if you have not heard about Ursula Burns and you on YouTube and you have some time, she has she's done interviews. There's interviews with her with other business leaders and things like that. And she has a fascinating story and how she got to her C-suite position to lead Xerox, and how her strategy helped turn the company around and all the innovative things she did. So back to this story on Roz Brewer and what she's doing over at Walgreens and why it's so important. So she talks about, she started as a bench chemist. She says she's always been a first. And unfortunately, many times I've also been the only African-American person in the boardroom or the C-suite. It's changing, but it's not quickly enough. So she's 60 years old and she's turning the $33 billion pharmacy chain into a destination healthcare company. This is really important. I think I talked about in a prior video about how with retail pharmacy, I know Walmart has done it in some of their flagship stores where you can go to Walmart, do all your Walmart shopping. You can go to the dentist, get a haircut, you can get your groceries, get your nails done. You can do your banking. So it's interesting what's happening in retail healthcare. So after stepping into power at America's second largest pharmacy we know what happened over the past 3 years, she has been pursuing a wide-ranging strategy to remake the company. In the past year, she led Walgreens through several acquisitions, drove technology investments. Again, this is retail pharmacy, but it's retail pharmacy getting into healthcare and utilizing technology, which is why this story is so important. Made internal changes to advance diversity and inclusion and championed the notion of equity in interviews. We're not going to talk about that in this video, but she says the biggest lesson is to question the status quo and make decisions, pull triggers. This year has taught me to never settle and to question. Okay, so bringing healthcare into your neighborhood. So now we're getting into the meat and potatoes here. So if all goes according to her vision, her strategy, Walgreens will be as well known for being a healthcare provider as it is for being a pharmacy. Well, the company's larger rival, CVS Health, is following a similar strategy of making healthcare a bigger part of business. I'm going to pause here and say, like, if you're a nurse, a physician, I know, and especially if you're on LinkedIn, I know I have seen CVS. I've seen positions for nurses in tech looking like openings for registered nurses, for LPNs, for CVS Health, for different roles in informatics and in tech. And they specifically, some of them require a nurse, or some require someone with clinical experience and background. That's why I'm talking about this, because it's retail healthcare, but it's also utilizing technology and also using and looking for people with clinical skills. So she says, I want my legacy as a business leader to be affordable, accessible, and quality healthcare in the U.S. All right. So part of the way they're doing that is through acquisitions. They did an acquisition of a chain of urgent care and primary care facilities, that Summit Health CityMD. And then they're going to do another acquisition of a company that specializes in specialty drugs used to treat complex and or rare conditions. What's interesting here, because you think about Walgreens and what their traditional business model has been, is a pharmacy and dispensing medications. But she says she said in a prior interview at a conference, dispensing of pharmaceuticals is not going to be our long-term growth avenue, meaning not just retail healthcare, but also health systems, hospitals. They're having to pivot their business models and find new streams of revenue and income that are not traditional. So, like, one of the traditional revenue models for a hospital or health system is, inpatient care, or, surgeries, or cardiology care, or cancer care, orthopedic center of excellence. But just like what's happening with hospitals and health systems having to find new ways to generate income beyond the traditional business model, you're seeing that also in the pharmaceutical industry as well. So her strategy also includes investing in new technologies, as well as advocating for a greater stake in mental health treatment. Now, there was something that I didn't want to read through the whole thing, but I wanted to call out what she said about automation. I've talked about the future of work and the use of automation and artificial intelligence for nurses, but it's also looking like it's changing pharmacy, the profession of pharmacology for pharmacists and pharmacy technicians. So she said she was excited about automating pharmacist and pharmacy technician work that slows prescription filling and cuts into time spent with customers. And then also their use of fulfillment centers for common prescriptions like high blood pressure, high cholesterol. She talked about food as medicine. Food is very healing, going into the holistic part of healthcare. But she said it's interesting. She sees Walgreens as a place where customers can get their prescriptions filled, see a nurse on site, talk with a social worker about arranging transportation to the next appointment, and maybe having a discussion with someone qualified to access mental health. So that's similar to what Walmart is doing with getting into healthcare, but also Dollar General. And I know I read an article, that article is old, but about how Dollar General is getting into retail healthcare, especially in like more rural areas where there have been a lot of hospitals that closed down, and now those areas may only have their access to healthcare is not what it used to be. Again, as the business model for healthcare, et cetera, continues to change. But healthcare is complex, and even the company's longstanding pharmacy business come with challenges. Then it talks about how Walgreens has been impacted by what's happening with the opioid crisis. And I'm trying to think, was there anything else? Here we go. So it's interesting how she's talking about culture, company culture, how it's important for business leaders or just leaders in general to support their employees' need for purpose, wellness, not just doing the work, but also, physical task of the work, but also, the mental capacity that it takes and how it can impact people. But she did say she's also, a part of her strategy has included eliminating task-based metrics from performance reviews for pharmacy staff, which reduces the pressure on employees and incentivizes staff to spend more time caring for patients. And then it goes on to talk about her D&I, or diversity and inclusion focus, and then also around disability for equity in the workforce. So that's the first thing. So some of the key takeaways with that, and the reason why I mention it, especially, as I talk about technology and money, but, technology and healthcare, but this talks to the future of work. And I did a video maybe about 2 months ago with Black Women Making Money and her YouTube channel, and we talked about the future of work. And there are other YouTubers on the business space talking about it as well. There's Erica Williams and the work that she's doing with Dr. Patrick Dix, etc. But you just think about the future of work and how, like, it is very evident in this article how it's impacting or will impact pharmacology. But I'll also say to a greater extent nursing, right? And the future of work and how we do and the opportunities for us bedside nurses going from the bedside into ambulatory type position, nurse practitioners. I have a friend who works for a retail pharmacy, and I won't say which one, but she is a nurse practitioner, and the work that she does and is doing is changing, and it's interesting. So I don't know, maybe I would get her to come on the channel to talk about how she has seen the work that she's doing on the retail pharmacy side as a nurse practitioner, how that's changing how she practices, but also care coordinators, right? People who do social work type work, and that's mentioned in the article. Number two, a key lesson or a takeaway is change in nursing practice, right? So more integration of technology and embracing technology as we do our work in caring for patients, wherever we're caring for patients, at the bedside, retail pharmacy, health insurance, startups, etc. And so a lesson or something to think about is, what does that mean for yourself, or an extent of that, your children or nieces and nephews, or young people that you mentor, right? What classes should they be taking, or should you be taking? Any certifications that you should look into, because, as these technology innovations are being rolled out, you have to do what you can to make sure you're skilling up and being prepared as these innovations, become more and more integrated into your work. And then number four, business strategy changes, right? So as business strategy, as companies change their business strategy, how does that impact? Does that mean you need to change your strategy or look at the strategy for how you're managing your career? That's why I pay attention to these articles and share them with you all, just to get you thinking, right? So you're not, me, us, we, the collective, are not caught off guard as these innovations are coming. Okay. And then again, the automation piece. And there's a whole, Dr. Patrick Dix, he's king of automation. He talks a lot about how automation and technology is changing and impact not only communities and people of color, but all people, and making sure that you are, managing your career, being strategic about your career, skilling up, etc. One other article I'm going to share, and then we're going to wrap up. Let's see, am I already sharing? I am. So this other one that I wanted to share is from Becker's, and is on physician and nurse and informatics leaders on the top trend of 2022. So what Becker's did was they went out and they reached out to chief medical informatics officers and chief nurse and informatics officers. So if you're not familiar with the position of a CMIO, a chief medical informatics officer, or a chief nursing informatics officer, a chief medical informatics officer is a physician that is in technology and is in a C-suite, a corporate C-suite position. And chief nurse informatics officers is the same type of position. It's a registered nurse. Typically, they're registered nurses who are in a technology organization. Some CNIOs actually have dual reporting relationships to both, like a chief nurse officer and a CIO, or a chief digital officer. But a chief nursing informatics officer is a registered nurse in tech in a C-suite position. So what Becker's did was it reached out to some CMIOs and CNIOs to get what their input is on the top trend in health informatics in 2022. And I like to share and talk about these things, because if you're a registered nurse at the bedside, looking for your next career, or maybe you want to stay at the bedside or stay in a clinical position, just being aware of the technology innovations that are coming, because it will impact how your practice in whatever clinical specialty that you're in. So it's interesting. The journalist says that chief nurse and informatics officer, also physicians, but since I'm a registered nurse, I'm keying in on the nursing part. So CNIOs, or chief nursing informatics officers, are gaining new powers and prestige in the health IT sector, or the health technology sector. Y'all know I key in on that. Anytime I see a registered nurse in a C-suite position, like a CNIO or a CIO or a chief technology officer, CTO, I always pay attention to that. So they asked these leaders what they felt like was top trends of 2022. There's two or three that I just wanted to call out. One talked about automation. Let's see if I can find it here. a digital transformation. So this chief medical officer from the University of Rochester Medical Center, I don't know how big of a campus, I don't know how many beds they have, but he says that he thinks one of the top trends was supporting digital transformation. And I talked about that in healthcare before, how some hospitals and health systems and companies, they no longer have a chief information officer. They're actually changing those titles to chief digital officer, CDO, as healthcare and the technology that supports it are becoming more digitized. So we were working hard to modernize our technology officers and offerings and workflows so that patients could have access to services that they've grown accustomed to. That wasn't the one I wanted to look at. Oh, here we go. So this one that I did that caught my attention, I wanted to mention, came from the CMIO of the University of Iowa. And he said that the top trend in informatics was robotic process automation for revenue cycle and prior authorization. So that's on the payer side, but I'm calling it out because, I've talked about and seen other articles as well and other outlets talking about the continued use of automation in healthcare, but also robotics and robots. So going to be more of that. Clearly they did it at this health system, but yeah. So he called that out. This CNIO from Moffitt Cancer Center, that's down in Florida, talks about the continued expansion of virtual care. So y'all know I did a video last week, I believe, about artificial intelligence driven virtual nurses. These are nurses that are in the hospital, but they're not in the hospital, right? They are in a virtual care center. I don't know if there are any hospitals or health systems having their virtual nurses sitting at home, but these are registered nurses, some LPNs who are providing care for patients in the hospital, but they're not physically in the hospital. And there are some health systems and hospitals that are using virtual care nurses with a back end of artificial intelligence to optimize patient care. So this CNIO talks about the continued expansion of resources for virtual care and how that dominated 2022, how that the acceptance of virtual care from patients forced the healthcare industry to accelerate the expansion of telehealth services. Informatics, here we go. That's why I say, even if you're in a clinical position or at the bedside, it's important to this because the CNIO says informatics played an integral role in ensuring nursing workflows and technology support providers in delivering high quality and appropriate care. And I believe there was one more C leader that said something that jumped out to me. Maturing data analytics systems, data-driven system, and drive toward data culture. Because remember, I've always said everything that is attached to a patient is a data point. Blood pressure, blood sugar, IV pumps. Like if you're working in an electronic health record, everything that you're documenting and capturing on a patient at some point on the back end is a data point, and they need someone or people to analyze that data and use data visualization to tell a story. And I believe that was it. Yeah, y'all. One other thing, and I'll just leave a link. And I came across this one very last minute, and it's out of Northwestern. But Northwestern has opened a new center for collaborative artificial intelligence in healthcare. Again, there's that AI and it becoming more integrated into healthcare and as a trickle down of that nursing practice. So Northwestern has opened a center specifically focused on collaborative artificial intelligence in healthcare and advancing that, right? So their mission of this new center, the center is called the Institute for Augmented Intelligence in Medicine. And they have a mission of advancing artificial intelligence, science, engineering, and translation through healthcare specialties and to create a positive impact on precision medicine. And I know precision medicine is a whole specialty dynamic. That's not in my wheelhouse, so I won't talk about it. But I'm just calling out this new center that is going to be doing research and training and more mentoring because again, it talks to the innovation that's happening in technology in healthcare. And it just a good reminder to just challenge ourselves to think about how these technology innovations are going to change our practice as registered nurses, licensed practical nurses, certified nursing assistants, and beyond that, other discipline. Yeah, y'all, that's it. As always, I'll be sure to leave a link to all articles in the description box. If you made it this far in the video and haven't liked it yet or shared it, please consider liking it. And I'll be sure to leave my contact in the description. And I'll see you in the next video.